And I'm delighted to say Dr. Bhasha Mukherjee is with me now, an NHS medical doctor, and this is the bit I love, former Miss England.
Yes.
How does that happen?
How does this happen?
Well, yeah. Oh, very good, very good. So how did you end up being a former Miss England?
Well, I think we probably have things in common.
I wasn't Miss England.
Well, you could have been Mr. England.
Oh,
you never
bless
know.
you. Go on. Carry on.
Well, I think I was quite a flamboyant person from a young age. I think the first thing I ever liked was being on stage. But at the same time, I also liked academia. So, you know, life was heading in one way from an academic point of view. But I still wanted to carry on the love for stage, the cameras, things like that. So I did modelling, acting. That led me to pageantry. Very unexpectedly led me to Miss England.
Amazing.
So, yeah.
Amazing. What is wrong with doctors? All these show-offs that are in the medical profession. And you are particularly interested in mental health, obesity, the impact that has on the NHS. It couldn't be more pertinent, could it?
Absolutely. I would say that if there are two things that are absolutely drowning the NHS and our society at the moment, is those two problems. And they're very interlinked, actually. You know, mental health has an impact on every single type of health problem that you can think of. And obviously we are in an obesity crisis, and we know the multifold effect that has on all the different health outcomes as well. So, yeah.
I'm glad you mentioned that, because there are a couple of stories I want to pick up with you. It was from The Guardian. The NHS is restricting access to obesity services across England, leading to patients in nearly half the country being unable to book appointments with specialist teams for support and treatments such as weight loss jabs. I'm deeply nervous about this because, yes, we have an obesity crisis, but equally this is also about empowering people to make great changes for themselves. And I'm just nervous that if we then over-medicalise it and then move to these GLP agonists, it's a very tricky road that we're now on.
I agree, and I do see a lot of, mainly women actually, come to see me and they're asking me about Ozempic, Wegovy. Yeah. It's all over the media about how wondrous this drug is, but we have to understand that everything has side effects.
Indeed.
And you're putting something into your body. It's not a simple fix. It's something that we know can be life-threatening. We've seen young girls turn up to A&E with starvation ketosis, and they're not even overweight. So there's
So do you want to just explain that? How would they appear with starvation ketosis?
Well, starvation ketosis is essentially your body going into starvation mode and starting breaking down fats, and not just fats, but
muscle.
Yeah, exactly. It can be a life-threatening condition, and as I mentioned, young girls who are not even overweight are turning up to A&E. It's a question about whether this is perpetuating body shaming in some ways as well, because I think people are more focused about the appearance of being overweight rather than having the holistic outlook of trying to target, you know, not just the medication side of things, but their diet, their lifestyle, their mental health, their sleep, how much exercise they're getting. Unfortunately, we live in a society that doesn't allow us to address all of these areas of our lives.
Not at all. And I think the immediacy of everything, and this links beautifully actually to social media, because young, particularly girls, not just girls actually, but boys too, they're inundated with pictures on social media, aren't they? Ministers are looking closely at the Australian government's move to impose a ban on younger children using social media. This is Peter Cart, the Technology Secretary, said he was really interested in the measures that were being introduced in Australia to set a minimum age for children to access platforms such as TikTok, Facebook, Instagram and Snapchat. And they think the Australian government will set a limit at about 14 or 16. What are your thoughts on that?
I mean, that's great, but we know some parents put their TikTok on their phones and they give it to their children. Unfortunately, when children are being stimulated in these ways, artificial ways through technology, once they've got a taste for it, they're going to keep wanting it. And then that child, you know, I see children come into my clinic all the time where they're, you know, wailing and they've got serious behavioural issues, and the only way to shut them down by the parents is by handing them the phone. So, you know, even if we bring age restrictions, ultimately it is in the hands of the parents in terms of what their child has access to.
And I think the problem is that then if you've got some kids with social media and others without, then there is the feeling of deprivation from those that don't have. I mean, what are we doing? Because I watch young children who are so ensconced in their mobile device, they don't actually see the world that's going past them.
Yeah, I agree. And it's now almost unheard of that a child will go to school without their phone. I mean, back when I was in school, I got in trouble for being caught with an earphone, hence discovering that I had a phone in my bag, which I used to keep off, by the way.
Right.
I used to only use it outside of school hours. But, yeah, my mum had to come in and pick up my phone afterwards because it got confiscated.
Well, I'm so old that we didn't have phones when I was at school. I didn't get a phone, actually, till after I left med school. That's how much older I am. Let's just talk about, I don't know what your view is on this, the UK's Online Safety Act. It hasn't been fully implemented, but it places a legal duty on social media companies to prevent children from accessing content that is harmful or age inappropriate, including pornography, self-harm and eating disorders. A chief achieved by either removing it from the platform using age verification or age estimation tools. And if the companies fail to comply, they can face fines up to 18 million quid.
I mean, it's well and good putting this into practice. I know China already does it with their own sort of demographic. TikTok is different in China with the young people as it is in the UK and in the USA.
Is that right?
Yeah, apparently so. Apparently it's a lot more toxic. The content is a lot more toxic for young people, whereas it's a lot more tailored in China. I don't know the full details, but apparently that's the case.
So the social media companies have a responsibility.
They have the ability as well.
And they have the ability.
Yeah.
There's another story as well, which I saw, about Novo Nordisk. You spoke about semaglutide, about Ozempic as well, Wegovy, these GLP-1 analogues. So these are injectable drugs that we have seen remarkable loss of weight when you use these. I wonder what your thoughts are on this, because Novo Nordisk, which is the maker of one of that, claims the obesity drugs, which we know can be effective, but as you rightly say, have side effects, can be effective in under 12s.
I'm shuddering at the thought of that, actually. I think for sure, you know, for very severe cases, there's always exceptions to it, 100%, right? However, what precedent are we setting for children under 12 to say that there's nothing but better than a medication? That's the age that we should be putting into place the diet, the exercise, and it is reversible. The most reversible, your most neuroplasticity, the most changeability is there at that age. That's the best age to reverse any sort of health.
I read this in the FT, actually. This was the Novo Nordisk weight loss drug is safe and effective in children as young as 6. Now, wait for this. According to a new company-funded study, paving the way for liraglutide to become the first treatment for obesity to be made, treatment to be made for that age group. Now, children aged 6 to 12 using the injectable pens for over a year saw a 7.4% reduction in their body mass index. Why don't they go for a run or just play outside?
Exactly, and I would argue that it should raise safeguarding concerns if a child is in the position where they need to take that drug. Because what kind of parenting are they getting? What kind of environment are they living in? What kind of food are they being fed? If that's what they have to resort to. And if the parents are then subjecting their children to that, I think that's very questionable. I would be very concerned about the child's well-being there.
Yeah, I agree with you. Well said, well said. Lots of messages coming in. If you have a problem that you want Dr. Bhasha Mukherjee to help you with, aches and pains, or whether it's trying to fight your way through the NHS system, which is very difficult at the best of times, do get in touch, please. 0344 499 1000. Text the word talk in your message to 87222. You can also access at Talk TV. This may be a bit tricky for you to answer. Pete says, I have tingling in my toes on my right foot. Very difficult. Could it be arthritis? Well, perhaps you'd like to answer that.
Pete, it's a very good question that you've raised. I think it's one of those things, if you're concerned about, you should go to your GP, because it could be a number of different things. It could be something as simple as, you know, you're spending too long standing and you know, not wearing the right type of footwear. You know, your doctor would need to examine you. They would need to probably do some further tests, maybe even blood tests. You know, there's so many different factors that can contribute, including even possibility of diabetes, vitamin deficiencies. So definitely get that checked out, Pete.
Well done. I'm David Ball, joined by Dr. Bhasha Mukherjee, who is an NHS medical doctor, and I'm rather intrigued, was the former Miss England, by the way, don't you know? Who hasn't been? Thanks very much for your help so far. Mrs. Moore, Joe, good morning to you. Joe says, David, the obesity problem in children has grown for the last 3 decades. Yeah, all linked to the same things. Firstly, we as parents in the 90s were scared by the media, mainly with daily stories of all sorts of horrible things. We were frightened to let our children go out, and then videos came in that solved the problem. But then, of course, the kids, I'm going to paraphrase this, and the kids were then stuck at home. It kept children safe in houses, and so on and so on and so on. And I think this is true, isn't it, that parents rightly wanted to keep their children safe, kept them at home and entertain them, but at the same time the advent of high-fat, high-calorie snacks, it's so easy to then eat so much without actually knowing it.
I agree 100%, and sadly we see the worst effects on the people from lowest socioeconomic backgrounds. You've just got to go into a supermarket to see how the food is advertised, and it's always done in a very strategic manner. I think a lot of people are not aware that as soon as you enter Asda or Sainsbury's or any of these supermarkets, you'll see donuts and cakes right at the front, at eye level of children. They're very colourfully packaged. It's all done for children mainly, and if you compare compare that with trying to get healthy foods, there's so many barriers to that.
I mean, it's so tricky, isn't it? Stick a broccoli or a donut, which would you go for? I mean, that's
exactly.
the problem.
And the price difference as well of fresh fruit and vegetable is more expensive than, you know, a bar of chocolate, for example. So it is sad that this is happened.
I would like to see fruit and veg being much cheaper and discounted. Like, you know, I know, for example, trying to get 3 for 2s or whatever it is, you know, on fruit and veg. I can but wish. Right, it's Jerry is in Essex on the phone. Good morning, Jerry.
Good morning.
Morning. How can our doctor help you?
I've got abdominal pain on my right-hand side. I've had it for about 15 years now. And,
Whoa.
I went through my local GP, done various tests, colonoscopy, etc., scans, showed up nothing. They said, I've got IBS. They give me various potions to try, and nothing works. And in desperation, I went private. I drained my savings. I went private. They took out my gallbladder. They said I had gallstones.
Wow.
Still had the pain. Went back to them a couple of months later.
Right.
And the doctor reluctantly done an investigation, laparoscopy.
Laparoscopy.
And he found I had adhesions on the entire colon, raising the upper colon.
Right.
And it was all due to an appendix which I had out 30 odd years ago.
There you go. So you got the result you needed, which were adhesions. Do you want to just explain what adhesions are for those people who are watching this? Sorry, not you. I was just asking our doctor.
Yeah, so adhesions essentially are a very common effect after any kind of surgery. Whenever there is any type of inflammation in the bowels or outside the bowels, in this case for this gentleman, he had appendicitis, it would have caused inflammation. And all those inflammatory cells, they are very sticky and they just get stuck on everything, and that includes whenever someone's in your bowels trying to do any kind of surgery. It does cause inflammation around the area, and what that causes is parts of your bowels to get stuck down together, and sometimes that can cause pain, like this gentleman.
So Jerry, given that you now know what it was, the adhesions, have they given you a solution in any sense?
It eased it for a good few months, but it's gradually coming back. It's uncomfortable near enough all the week long, and with quite a few periods of where I'm doubled up in pain. Been back to the doctor, and he said more surgery is not an option.
Any thoughts?
Yeah, I'm really sorry to hear that about your experience. It does sound like it is really impacting you. I would say that, yeah, I mean, your doctor is probably right. You know, as I mentioned, more surgery can potentially cause more adhesions. That could possibly make things worse.
Is there anything that Jerry can do, do you think?
Well, it sounds like Jerry's been through a lot for so many years. He's probably exhausted pretty much all the types of resources. You know, there are suggestions to say that, you know, reorientating your relationship with pain is helpful. And that could
include
a
second opinion?
Therapy.
Is it worth getting that?
It sounds like he's had several different opinions, actually. And I must say, like, I mean, if this has been going on for 15 years ago, our NHS was in a good place. Yeah. So we can't even say that this is recent. So I would say that he probably has seen most of the specialties and most of the people that could give him help. And now maybe thinking about his symptoms, managing those. You know, CBT is shown to be helpful in people with chronic...
behavioural therapy.
Yes, yeah, type of therapy, essentially, can be seen to be helpful in people who live with chronic pain, like this gentleman here.
Jerry, I'm sorry we haven't got a sort of golden wand for you, but I hope that is helpful. We'll go to...
Our son died on the 2nd of October last year from ketamine overdose and drowning.
I'm so sorry.
Thank you. He was in Cambodia at the time, and it was about 20 days before Matthew Perry died in exactly the same circumstances.
Ooh.
He was in. He had a room in a hotel where he'd been before. It was a favourite room which had a private pool, and that's where he would go. He was 35. So it's coming up to the anniversary of his death. He left a little girl of 4, and his partner was pregnant at the same time, and so she gave birth on the 1st of January after his death. We knew he had dabbled. We knew he did like the drug, and there had been issues when the first little girl was born where social services stepped in because his partner was violent to him, and he had, the social services were aware he'd taken drugs. And I went through the entire guardianship process, but because he had various hair strand tests, and they went through various different relationship courses, and she had anger management, and he was clean. The court decided everything was fine, and everything proceeded. I didn't have to step in as guardian, but it was. He was a high flyer. He was a very successful businessman, owned numerous properties, and he was doing so well. But obviously there was this in the background, his switch off. His mind was going all the time, and so we think it was a kind of switch off. And we'd often expressed our dismay, our sadness of everything, and how it could damage him. And he was saying, "Don't worry, it's rare that I take it. It's rare, and it's always it would be away from the home. I wouldn't be putting my daughter into, and this would dismay us terribly."
Of course. I mean,
he's a man. You couldn't stop him from doing something like this.
Let me just bring Bhasha in here, if I may. I'm so sorry. This is often what we hear as well, is high-flying people resorting to drugs recreationally. I think also in terms of ketamine, we're seeing a lot of it in inner cities now across the UK, and as I said right at the beginning, it's cheap. And I think that point actually that Melanie's made is that users think they can control it, and they can't.
I think that goes for a lot of different drugs, actually, and it's so sad to hear your story, Melanie, about how this has devastated a whole family, even though, clearly your son was, clearly battling some mental health problems in the background. As you mentioned, he was a high flyer, but his coping strategies were resorting to drugs. And as your guest previously said, we need to harbour a society where men can talk about mental health, young people can talk about mental health, they can access mental health services rather than resorting to essentially self-medicating through various methods like ketamine, other drugs. Opiates was mentioned earlier as well. And sadly, I think you're quite right. We have failed as a society that we can't regulate these things very well, and we haven't got the resources, clearly, to support people and their mental health problems, as is clearly visible here.
Melanie, can I just ask you, for parents watching this, did you know what drugs he was taking, and did you know anything about ketamine?
Yes, we knew ketamine was involved. I did pharmacology at uni, and was a biochemist, so I knew very well, and discussed it often with him, and he would say, no, it's not a problem, it's so rare that I ever take it. And what can you do if someone is in denial? I don't know how frequently he does it. We don't know what health problems he had. He would talk to me frequently. I mean, he loved me very much. We had a great relationship, he and his father too, and it was fantastic. But that thing he kept, because I think he knew there was a problem.
Yeah.
It was he even was setting up power of attorney documents. He had written a will. Unfortunately, he didn't sign it. It's resulted in his partner being in control of everything, and she's now refusing to allow us to see his children. It's really messy.
Melanie, thank you so much for calling in this morning and telling us your story, and our thoughts are with you. That's awful. I just want to re-emphasise about ketamine. It's worth just looking out for. It's very, very cheap, and the onset of effects is rapid. It occurs within a few minutes. The problem with ketamine is it's also idiosyncratic. Like many of these drugs, you have absolutely no idea what the end result's going to be. You can become agitated, depressed, have cognitive abilities, and more importantly, also it can render you unconscious. But I think it's just worth saying drugs are out there, and as a parent with young teenagers, it's important to have open, honest conversations about what drugs are there and what the side effects of those drugs are.
Yeah, and have a safe place at home to discuss these topics as well. I'm not a parent myself, but as parents, I would say, as clinicians, we would say there should be a place of no judgment with people's choices, and we should support them and empower them to make the best choices, and also how to make those choices, even if they're not in their best interest, how to make them safely. So the first point of call is to not show judgment in these cases.
But I read up on statins, and it does show that there can be effect on blood sugar in the body, and the last thing I need to worry about is getting type 2 diabetes, because I'm 73.
Oh, you're a youngster. Are you, dare I ask, are you overweight?
No, I don't think so.
Good.
I've been the same weight for about 30 years, 11 stone.
Fantastic. Now, who prompted you to get statins?
The surgery do an annual blood test and check things, and cholesterol, my LDL was about 6.
Right, so low density lipoprotein. Right, OK, your thoughts?
Right, so first of all, it's an individual basis case about whether you should be using statins or not. It sounds like, I'm sorry, I forgot your name. What's your name?
This is Stella.
Stella, it sounds like, Stella, you already have the risk factor with regards to your heart health with the high blood pressure. You've been on the medications, it sounds like. And there is a risk analysis that we do, and it sounds like that's what happened. You had some blood tests done, and a new risk analysis was done based on your age, based on your gender, based on your even your postcode. can be taken into account, and also other risk factors like family history of heart health, other health conditions you might have, and it gives us a number. And usually we offer statins to people who have what we would call a slightly higher risk of getting a heart attack or a heart problem, essentially, in the next 10 years. And it sounds like for yourself that might be the case. Am I correct? Is that why you were offered the statins?
Yes, I think I was told I had a 17% chance of dying in the next 10 years, but there's no history of heart problem in the family.
Right. So this is preventative medication, just in terms of side effects, because obviously what Stella wants to know is, will she have side effects from the statins?
So for majority of people, they do not experience side effects. Some people can experience some muscle aches. If that does happen, please go see your GP.
Does that tend to wear off, or is that...
Sometimes it does. Sometimes it's an incidental finding. It might not be caused by the statins at all. Sometimes lowering the dose of the statins can be helpful, switching to a different statin, or even switching to a non-statin, but another different type of cholesterol-lowering drug. There are other options as well. But it's really important that we control that cholesterol, because that will hopefully prevent things progressing and you getting that heart attack that you've been told that you could have, potentially.
So, Stella, does that reassure you?
Well, I'm really interested in the blood sugar because a lot of people in my age group I know do have type 2 diabetes.
Well, yes, but it might be for other reasons as well.
I understand that, but it's also for me, as I'm a hypochondriac, the last thing I need to do is have to worry about something else.
No, fair enough. But my understanding from what you're saying is I don't think that's really a problem to think about. Stella, thanks very much for your call. Ian is in Tunbridge Wells. Good morning.
Good morning.
Morning. What's on your mind?
So I suffer from a condition called restless leg syndrome and have done for about 10 years.
Yeah. Just explain that to people.
So it normally comes on when I'm relaxing or in the evening at bedtime. It's a kind of manic compulsion to move your legs, and you can't stop it. It's like you have to walk around. So if I'm lying down, I'm kicking out, my legs are shaking and trembling. It's crazy. And I've been on a drug called pramipexole for about 10 years.
Right.
And I just wonder if there have been any developments in the treatment of this weird condition.
Yeah, it is weird. It's a very weird condition. Thoughts?
Yeah, I mean, it sounds like you've had this condition for long enough, and often people who have had a condition for long enough, they know more about their condition than doctors do. So, I've learned something from you today. I've not heard of this medication that you're on. I'm not aware of anything new. My first point of call when people come in with restless leg syndrome is the old medication quinine. We still use that, actually.
Really?
So I was curious whether that was offered to you at all.
No, I was on another drug before, but it left me really groggy. I forget the name of it, but I was moved on to pramipexole, which I think is used in people who have Parkinson's to stop the shaking and stuttering.
And have you seen a neurologist?
No, only a GP.
GP. Is it worth seeing a neurologist, or would they just say it's restless leg syndrome, go away?
Quite possibly. I don't know, the waiting lists are so long in the NHS now, it's really difficult to say what kind of things get battered out. At the moment, a lot of GPs are having to manage quite complex cases and things that are quite beyond the remits of GP. But yeah, that's...
I just wonder whether... are you on any forums for people with restless leg syndrome? Because often they're a great font of knowledge.
I'm not, actually. That's something I should check out. I'll be interested to have a look at that.
Yeah, have a look, because it's kind of like one medication works for one person and not for another person. It just might be worth having some sort of look to see what other people advise. Yeah, well, hopefully that helps you a little bit. Ian in Tunbridge Wells, thank you very much for that. I just want to mention this one story here. A patient who used the services of a mental health charity said trampoline therapy had significantly improved her physical and mental health. This is a lady called Simone. She had a variety of rebound therapy sessions. And essentially, rebound therapy, I'd never heard of, involved the use of trampolines to provide therapeutic exercise for people with various needs, physical disabilities, learning disabilities, sensory impairments, and autism. She now says she feels a lot fitter physically and her mental health has improved. Doesn't that just underline how important exercise is?
100%, and we know that exercise reduces all-cause mortality, and it is as good as a low-dose antidepressant. So I would recommend...
What sort of exercise?
Any exercise. You just got to move your body. And I think that there's a lot of stigma out there. A lot of you'll go to fitness specialists and they'll tell you, oh, you need to do weights, oh, you need to do cardio. I would say, if you're moving, that's good enough. If
you're moving, that's good enough. Also, I've been told by Rona, magnesium. Try magnesium for restless leg syndrome. So there you go. Dr. Bhasha Mukherjee, thank you very much indeed for your time this morning.